So first, I would like to ask your permission to use this video for educational purpose and on internet.
Yes.
Now, tell me about your symptoms before the surgery.
Extremely bad back pain, lots of leg pain, hard to do daily tasks.
How long did you have those symptoms?
Before I started like really aggressively treating, probably about 6 months.
6 months. And the pain you had was going down your legs?
Yes.
Show me exactly. Where was it going?
It was my right leg. It was all the way down to my big toe. It would be shooting pain.
How bad was the leg pain?
Pretty bad. Yeah. Sometimes. Yeah. It's really bad. You have to.
How far could you walk with that?
Maybe a block.
Maybe a block. Now we did a surgery, and we did not a small surgery, but a big surgery. If you want to come closer here, this is what we did here. We did a L4-S1 fusion. We are only 4.5 months after the surgery, correct?
Correct.
And the bone actually start to grow, and I'm going to show you here that the white inside of the cage or the spacer is actually the bone growing, and growing in both levels. The bone in the back, in the bottom level, is growing, and in the upper level is still working on that, but that's pretty good for what we got. This is very good, and this was not a small surgery. It's a big surgery. Fusions are always a big surgery. How long did you stay in the hospital?
2 hours.
So 2 hours after the surgery, you were ready to go home?
Yep. No, 2 hours from the time I got there till the time I got to go home. Like your part only took, I think you said like 20 minutes?
No, it took me actually, I can look it up actually. I can see how long it took.
Maybe it took you like an hour and I was there.
It usually takes me about an hour to do this surgery. And our blood loss was, usually it's about in tens of cc's. In your case, the surgery was 52 minutes and our blood loss was about 3 ounces, less than half a cup of coffee.
Okay, wonderful.
So, when did the leg pain go away?
Almost immediately.
So you woke up, leg pain was gone?
Woke up once all my, the Novocaine and stuff from the surgery wore off, I didn't have the leg pain anymore.
But you had some tingling there.
Yes,
tell me about
my nerve, it was like almost like my restless leg syndrome, that nerve like shooting, irritating. Lasted a couple of months, but it's gone now. So
that is what we talk about, that I have to push a nerve to this side. That sometimes just that nerve get irritated, and then usually again after a month or two or so it goes away. Now how is that now? How is that tingling that you had?
It's much better. It's gone now.
What would you call overall your pain in the lower back and legs these days?
It's almost non-existent unless I overdo it myself.
Yeah. How is the daily activity going on?
Much better. It's increased a lot.
And walking?
I can walk a couple of miles now without problem.
Well, that was a success. So far, it's a success. Obviously, it's just 4.5 months. It's still going to heal and it's going to progress, but the bone is growing, the leg pain is gone. So this is practically for us a routine kind of results. But this is not a routine in open old-fashioned surgery. But nevertheless, this is still going to get better. This is not the end of the healing process
yet.
That's
even better news.
Yeah.
Because I feel a lot better.
Overall, happy with the results so far?
Excellent. Yes, more than happy with the results.
Well, thank you for the interview. I really appreciate that. Thank you.
Yeah, you're welcome.
Now,